Today we are going to see one very important topic where most of the people will confuse about PVD versus PAD. Most of the time we will encounter these two words, but most of the people don't know the difference between PVD and PAD. So in this session we will learn what are the differences between PVD and PAD, how to code PVD and PAD, as well as we will see few example scenarios related to PAD and PVD. So by the way, PVD means peripheral vascular disease. PAD means peripheral arterial disease. So after watching this session, if you like this session, please click on like button so that I can create more videos which will be useful for each and everyone. First, we will see peripheral vascular disease. As we have discussed previously, peripheral vascular disease short form is PVD. So what is PVD? Any disorder that affects blood vessels outside the heart and brain. So basically the name itself indicates vascular. So PVD related to blood vessel disorder which is outside the heart and brain. So here the term vascular includes arteries, veins or any type of lymphatic vessels. So this PVD is not related to any specific blood vessels. So basically it is related to arteries, veins and lymphatic vessels. So what are the example for PAD or PVD? So peripheral arterial disease, one of the most important condition related to PVD, and also chronic venous insufficiency, deep vein thrombosis, varicose veins, lymphedema. So if you observe this one, all these conditions are having arteries as well as veins as well as varicose veins. So what do you need to understand here is PVD is the combination of arteries, veins as well as lymphatic vessels. So if you see here, we have lymphedema. So PVD includes lymphedema also. Just lastly, you need to remember PVD is the umbrella term for all peripheral circulation problems. So whether it is problem related to artery, vein or lymph glands. Next we will see peripheral arterial disease. So previously we have seen peripheral vascular disease, correct? So PVD includes arteries, veins as well as lymphatic vessels where flow is possible. So PAD is a subset of PVD. As we have discussed, PAD is a part of PVD. Okay. So specifically PAD refers to arterial narrowing or occlusion due to atherosclerosis. Okay. So as we have discussed previously, PAD includes only arteries, not veins or lymphatics. So this PAD leads to reduced flow to extremities. Commonly we will see PAD in the legs. So most common complication we will encounter while coding is intermittent claudication, means leg pain with walking or relieved by rest. Usually we will call it as intermittent claudication. And this intermittent claudication is the initial symptom of PAD. It may turn to critical limb ischemia, ulcers as well as gangrene. So which are the more complicated symptoms of peripheral arterial disease. I hope now you got the difference between PVD and PAD. So still if you have any doubt, please mention in the comment section of this video. So here we have one table where you can find the difference between PVD and PAD. So basically based on pathology, PVD means pooling of blood in the distal extremities, mostly in the hands and feet. So basically pooling of blood is called as PVD. So if we see peripheral arterial disease, low oxygen and blood in the distal extremities. So here the oxygen is very less in peripheral arterial disease. If someone is having pain due to peripheral venous disease, it will be dull and achy pain. So for example, if the patient is having peripheral arterial disease, they may feel the pain as very sharp. In peripheral vascular disease, you can see the edema or accumulation of the fluid due to pooling of the blood. In peripheral arterial disease, you will not see any type of edema. In peripheral venous disease, you can't encounter gangrene, whereas in peripheral arterial disease, you will encounter gangrene. Even we have variation between temperature related to PVD and PAD. In PVD, you feel blood is very warm due to pooling of the blood, whereas in peripheral arterial disease, you will see the blood as very cold as there is no blood or blood quantity is very less. So now we will see the documentation says peripheral vascular disease. So basically this is the decision tree for PVD and PAD coding. Okay. So peripheral vascular disease documentation says peripheral vascular disease. First, you need to check if provider specifies artery involvement. Okay. For example, documentation is having the PVD. So the documentation contains artery. So you need to code peripheral arterial disease. See here, this is the yes. So arterial disease, atherosclerosis, claudication. Code as PAD. So the documentation contains PVD related to artery. You need to code it as PAD. For example, documentation is having PVD and it does not include any type of artery. So that time we need to code it as PVD, unspecified, I73.9. For example, if the documentation does not say PVD, so how do we code? For example, documentation says venous disease. So we need to check for whether it is varicose veins, venous insufficiency or DVT. So based on that, we need to use codes I83, I87.2 and I82. For example, documentation says lymphatic disease, mostly lymphedema as well as obstruction. So that time we need to use lymphatic codes, which starts from I89 and I97 series of ICD-10 CM codes. For example, documentation says arterial atherosclerosis. We need to use PAD codes. As usual, I70 series codes. As the name itself, arterial. So we need to code it for PAD, not PVD. Just here, we need to remember separate series for PVD as well as PAD. For PVD, we need to use I73 series. For PAD, we need to use I70 series. So we'll see few example scenarios here. For example, documentation is having PVD with intermittent claudication. As all of us know, most of the time you will see claudication in arteries only. So you need to code it as PAD, I70.213 for bilateral legs based on the documentation, whether it is unilateral or bilateral. Next, for example, if the documentation contains history of PVD, unspecified. So here documentation does not contain any artery, vein or lymphatics. So you need to code it as I73.9 PVD unspecified. Okay. Next, for example, documentation contains chronic venous insufficiency with varicose veins. So as we have discussed previously, all these venous insufficiency codes comes under PVD. So here we need to use I87.2 or I83 series codes. So these chronic venous insufficiency as well as varicose veins not comes under PVD, but these are the conditions related to veins. Next we have critical limb ischemia due to PAD. So as we have discussed, ischemia is related to PAD. So we need to code it as arterial ischemia. So here we need to use I70.26 and 6 character based on the documentation for ischemia. So okay team, so thanks for visiting FastCoder 21. So if you have any doubt, please mention in the comment section. If anyone looking for same day surgery coding training, IPDRG training, ICC training or CCS certification training, please contact 707-526-3939. If you have still any doubts, please mention in the comment section of this video and also encourage your friends to subscribe to FastCoder 21.